Welcome to our ACTA update webinar. A few technical notes regarding our webinar today, which should answer some of the questions we have in the chat. First of all, I'd like to let you know that this is being recorded so that we can post it for people's information later. However, your microphone as participants and your video you do not have access to, and the chat and Q&A comments will also not be shown in the recording. I would like to ask you to please post your questions to us to the Q&A. You can see a box at the bottom of your screen for that purpose. Some of you have already found the chat, and we certainly won't discourage you from using it. Shout outs to us as well as your colleagues informally. But if you can put questions to the panelists in the Q&A, that will help us stay organized and make sure we don't miss any important questions. And also, just so you know, the questions will be addressed in the second half of the webinar. We have over 250 people who have registered for this webinar today, as well as many others who are planning to watch the recording. And on behalf of the ACTA board, I would like to thank you sincerely for attending. We do know that there are many other ways to spend your lunch hour on a rare Alberta summer day, and also to thank you for your ongoing interest in the regulation of counseling therapy, addictions counseling, and child and youth care counseling professions. This endeavor would not be possible without the support of ACTA members and all members of the three professions, the counseling associations in Alberta, as well as individuals and institutions who educate new members of our professions and members of the public, all who understand how vital it is to put protections in place for those who are vulnerable. And so we thank you today for attending this update. And also we thank you for your questions. The questions that we receive on a daily basis help us greatly. Sometimes they remind us that our communications and messaging needs improvement. And in other times, because we have never built a college before, your questions lead us to more research, consultation, and reflection, and ultimately to build a better college for the protection of the public and Albertans. I would like to introduce our panelists now. My name is Nicole Imgrund, and I am the chair of ACTA. Also joining us today is Russ Webb, who is the member at large on our board for counseling therapy, Sean Swaby, who's the member at large for addictions counseling, and Patricia Kosturis, who is the member at large for child and youth care counseling. Also joining us is our registrar and CEO. Linda has been our registrar since October, and I have to say it has been a game changer for us to have someone with Linda's extensive experience and leadership skills on our team. As we share today the progress that we've made, I think that you'll appreciate how exciting it has been for us as a board to see the new college take form and for us to move forward in leaps and bounds under Linda's leadership. So I'll ask our panelists if you want to go off video, and we'll come back later as we answer questions. And then we will start with a presentation by myself and Linda to give you an update on what has been happening. So some background. ACTA is, the ACTA board is comprised of 2 representatives or directors from each of the 12 member associations of FACT Alberta. And those associations are listed on our website if you're interested in looking at them. FACT Alberta was established in January 2015 to advocate for regulation of the professions of counseling therapy, addictions counseling, and child and youth care counseling. But it's worth noting and reminding ourselves again that the advocacy efforts for regulation preceded FACT Alberta by about 15 years. Most of the associations and even some of our current board members have been involved with this process for well over a decade. Furthermore, I know that many of you participating in this webinar today have also been part of this history and contributed to this endeavor in both formal and informal ways. The mandate of FACT Alberta was actually achieved on December 11th, 2018, with the passing of the Mental Health Services Protection Act. As a result of this legislation, the professions of counseling therapy, addictions counseling, and child and youth care counseling will be included in the Health Professions Act. A new College of Counseling Therapy of Alberta will be granted the legislated authority to provide oversight and accountability and to protect the public when receiving mental health and addiction services. The Mental Health Services Protection Act also established that a new society, the Association of Counseling Therapy of Alberta, ACTA, would be formed to develop the new college. Upon proclamation of the new college, ACTA will actually be dissolved, and members of ACTA will become the first registrants of the new college. The elected executive of ACTA's board will join the newly appointed public members in forming the first council of the new college. Some of the board members of ACTA who don't move on to the college may move back to under the umbrella of FACT Alberta. And we anticipate that FACT Alberta, once the college is proclaimed, will become active again. And we've already started envisioning its new mandate. You may hear a little bit more later today about things that we anticipate being part of the mandate of FACT Alberta. But its new board at that time will do that work, and it will carry on as an advocacy association representing the different counseling professions and professional associations in Alberta. And so just worth noting again that with the formation of ACTA as a society on September 5th, 2018, the members of the FACT Alberta board all fully transitioned to serve the ACTA board and to embrace excitedly our new mandate to develop the college, which we are in the midst of doing. And I'm happy to give you an update today on how that is going. It has only been, hard to believe, but it's only been 10 months since our first AGM for ACTA, which was on September 5th, 2019. And since that time, we have experienced an incredible amount of growth. The expedited route opened on August 29th, and to date, I'm happy to report that we have 881 new members of ACTA with another 608 applications that are currently in progress. I would like to take this time, just as I did just a few short weeks ago at our AGM, to offer our thanks to each of our new members of ACTA for stepping forward to support regulation and the process of developing the new college. Without the support of these individuals and their willingness to register in advance for the expedited route, we simply would not have the resources to build the new college. The movement to advocate for regulation was only successful because all of the associations worked together for the sake of the greater good under FACT Alberta. And the college will only come to fruition because individual practitioners have stepped forward in that same spirit of collaboration and sense of responsibility for the protection of the public. And as the board has seen those numbers increase and grow each month, we have a couple dozen new members just since our AGM. It has really bolstered our commitment and our energy for this work. And so we want to thank you again for that. The past 10 months or so over the past year have been very busy and active for our ACTA board, and I'm going to offer some highlights of our time. working together. So we had the expedited route open and developed the registration for that. We hired our first registrar and CEO, which was very exciting for us. We had some in-person work meetings when such a thing was still possible, right? To hold meetings with big groups of people in one room. That was last November in Edmonton. And actually, all these years of working closely together on a daily basis, often, for sure weekly, we've only a handful of times seen each other in person. So that was actually quite eventful for us. Hopefully we'll get to do that again soon as well. We continue to work on the regulations with Alberta Health. And also it was a very active time for us, especially in the past few months. I'll say more about this in a bit, related to government relations and advocacy. We completed our drafts of the Code of Ethics, the Standards of Practice, and Supervision Guidelines, which will be sent out in the government consultation, hopefully very soon. Although you also can access copies of these things on our website already. We started working on the advice to the professions documents. We will soon be posting a definition of what advice to the professions documents are, and also a sort of a map so that you can understand how all of these pieces, Code of Ethics, Standards of Practice, Advice to the Professions, relate to one another as regulated professionals. So all of that's on the website, but the first ATTP, actually we just got the very last copy of it last night, and it was the ATTP on affirming sexual orientation and gender identity. And we will post that to the website, if not today, in the next couple of days for sure. The board has also been busy with member communications, including this website, newsletters that we're posting. We are working on bolstering our social media presence, so bear with us as we move towards that as well, and obviously communicating with members consistently through email and other means as well. And also collaborating with and advising our registrar on an ongoing basis as we work together as a team, the board and our registrar and also administrative staff, Kelly. There were two major events external to college development that required the board's consideration in this period of time as well. One of them obviously is COVID-19, the pandemic, and the other more recently is the Black Lives Matter protests. In both instances, we had an opportunity to view our mandate through a new lens. The pandemic presented us an opportunity to support members as they confronted an unprecedented challenge in their work. We were asked by the government to provide leadership to our professions in the same manner as a college, which was actually a milestone for ACTA and a really significant step for us as we move towards our emerging role as a regulator. We understood our role in this situation and continue to as providing resources and guidelines to practitioners to meet the challenges that they are facing and for assistance and interpretation in following the provincial health guidelines. The Black Lives Matter protests have been an opportunity for the board to consider how we can build our college, our new college, on a solid foundation of embracing diversity, ensuring fairness and equity, and a commitment to anti-racism. At this time, the board is in full listening mode for experience and wisdom outside of ourselves to guide us on this path. We're currently reviewing a survey that our members have been filling out in the past few weeks, and we're very appreciative to ACTA members who have participated in this survey and who have shared with us their lived experiences, their perspectives, and their knowledge regarding social justice and racial justice and anti-racism. This feedback, other education and learning that we're doing as a board and consultation will help inform our next steps and ultimately the development of our college. board increased its government relations and advocacy efforts in the last several months with the goal of ensuring proclamation for the new college in the fall. The COVID-19 pandemic further highlighted the imperative and urgent need for CCTA to be proclaimed in a timely manner. However, COVID-19 also made it more challenging to have this message heard over the immediacy of the crisis and also to request resources needed to move it forward from the government. Despite these challenges, our efforts were successful, and we were very relieved and also excited, and continue to be in the past several weeks, to receive confirmation from Alberta health officials and the Minister of Health that proclamation is a priority for fall. And you can see in our slides here some quotes, one from the Assistant Deputy Minister for Health, Workforce Planning and Accountability Division of Alberta Health. And I will post also on our next slide a quote from communication that we received from the Minister of Health on May 28th, Minister Shandro, who states that he appreciates the importance of regulating counseling therapists, addictions counselors, and child and youth care counselors. And I have directed Alberta Health to prioritize this work. Please continue working with Andrew Douglas, Director, Health Professions Unit, Alberta Health. We certainly have been in communication, and we've been in communication closely over the years as he's so supportive of helping us navigate our journey, Andrew Douglas, and our understanding from further communications with Alberta Health is that they intend to commence with the consultation still this summer. And given this information and our knowledge of the process, I can say that our best guess is that the new college CCTA will open its doors between October 1st and February 1st. And each week that goes by that the consultation doesn't commence is what pushes those deadlines back closer towards the new year predictions. The board and registrar are working together intensively and diligently to ensure it will be this time frame. And it would appear that this is the last sprint in our long marathon towards regulation. Just to conclude my report, on behalf of the board, I wish to acknowledge the extraordinary efforts and talent of our staff, our administrative assistant, Kelly Keenan, and our registrar CEO, Linda Solly. And also, I would like to take this opportunity myself to thank my colleagues on the board for their continued commitment to this work. They consistently inspire me with their willingness to volunteer their time and their talents to this effort. And I thank them on behalf of myself and all of us and the public for their continued commitment as we move towards proclamation of our college. And with that, I turn it over to our registrar and CEO, Linda, to guide us through your work in developing the college.
Thank you, Nicole. Before I begin, I just want to congratulate everyone, the professions on this journey. It's been a long journey for you. I started with you in October. Certainly you've been going at this much longer than I have. And my sincere congratulations on coming this far and making it to the final countdown here, the final sprint toward the college opening its doors. I'm going to talk a little bit about the work that we need to do. So Nicole's talked about a lot of what's already happened, and I'm at a high level going to talk to you about a bit about the work that we will continue to do before we open our college doors, and a little bit after we open as well. I'll start with registration. So our expedited route has been open since last October, or yes, since last October. The expedited route is an intermediate route, or what has commonly been referred to as grandparenting. So to open up the other routes, we're going to need to do some work on identifying the intermediate route specifications and the regular route specifications. The regular route is going to be the route that everybody enters the college once we are all complete, up and running, and the quote-unquote grandparenting segments are complete. We need to develop the technology to support that, and that's in process right now. And we'll need to, of course, develop an appeals mechanism for decisions made on entrance into the college. Next slide, please. We're going to need to develop our register, so our public-facing register, the regular one, a provisional one, perhaps a courtesy one, and maybe even a student one. We're still talking with the board about whether we will have student membership and what that will look like. We're working on the examinations for counseling therapy, addiction counseling, and child and youth care counseling. The counseling therapy and addiction counseling examinations are nearing completion, and we are now focusing efforts on the child and youth care. And then we will be doing our jurisprudence modules. So that's in the works right now too. So as we move forward, we will have those ready for you to go. So next slide, please. And as Nicole mentioned, we are doing the advice to the professions. We will have to establish as well a continuing competence program, which is in some jurisdictions referred to as continuous learning programs or quality assurance programs. And we will be the board working with the board to establish what that will look like. And of course, we'll have to have our professional standards program developed, and all of the policies and requirements and staffing for that. And the professional standards program will be things like compliance, complaints resolution, etc. And then we'll have to establish our tribunals mechanism for those matters which will need to go to hearings. College operations will need to be determined. So we're working on a staffing plan, and we're going to have to hire those individuals into particular positions. We're going to need business supports like financial services, communications support, information technology, policies regarding retention and disposition of records. So all of those business support things. And we're going to have to secure a location, which is in the works right now, a physical location for when we need to be present together. And then we're continuing with the ACTA administration. So the day-to-day requirements of and care and feeding of a society under the Societies Act. We have some legislative reporting to do. We respond to the challenges and opportunities that are coming our way. And we will eventually have to dissolve ACTA, and that will come with its little bundle of work to do. And we migrate to becoming the college. We'll also have a lot of communications work to do as ACTA transitions to the CCTA. And that will be its own portfolio of work that will keep us quite busy. So now I'm going to transition into some commonly asked questions and some of the questions that have been sent to us by our membership for which we wanted to answer today live for everyone. We may not get to everyone's questions. And please know that our intention is to answer all of the questions. If we don't get to them here today, we will send answers out. So I'm going to start with the question, what are the benefits of being an ACTA member and a member of the college? So ACTA is the precursor organization to the College of Counseling Therapy. So once proclaimed, ACTA will become become the CCTA. So joining ACTA through our expedited route or our intermediate route, if that opens soon, allows those qualified professionals to be grandparented seamlessly into the college once proclaimed. Registration with the college will be mandatory in order to use the titles, the regulated titles, or to work within the scope of practice of those titles. So being a member of the college will allow you to continue your practice in your profession. And there are many benefits of having a regulatory college overseeing your professions. Historically, national and provincial professional associations have held a dual mandate, one of them being that they were provided a member service function, such as promoting the profession, negotiating fees and benefits, advertising, newsletters, continuing education. And then the other one is kind of a non-binding quasi-regulatory function, such as certification, standards of education, standards of practice, codes of ethics, and complaints investigation. When the College of Counseling Therapy is opened, it will be a true regulatory body for the professions. And that means that compliance with the standards of practice and codes of ethics will be mandatory. And standards for licensure will be set and continuous learning will be required. And this elevates the standard of the profession for everyone and ensures the protection of the people that you serve. Next question was, should I maintain my association membership after I become a member, sorry, I should say member, not membership, of the college? I will say that while it is optional to maintain your association membership, it's strongly recommended as a best practice. Colleges and associations have different mandates, as I've just outlined. And with both college and association, we have a system that protects the best interests of the public, which is the college, and the professions, which is the association. By having a college, the professional associations are able to divest themselves of their quasi-regulatory function, and they'll be able to focus really strongly on their member services and advocacy. And this will benefit the professions, and it'll help to alleviate confusion about the roles of an association and a college. And regulation gives the profession so much more status in the eyes of other regulated professions, may provide access to third-party billing, and may provide more employment opportunities. Although regulation can't guarantee these benefits, once regulation occurs, your professional association will advocate with insurance companies and employers to realize these benefits. So this is how the system works to benefit both. And this is why we recommend that maintaining association membership as well as your college membership is a best practice. Next slide, please. Will we have to continue paying membership fees to ACTA or the college and our individual associations as well? Like I said, while it will be mandatory to join the college if you wish to practice within your scope, or use the restricted titles as outlined in the regulation, and it's optional for you to join your association or maintain your association, it's strongly recommended as a best practice. And therefore, there will be fees associated with both. So next question is, I am a member of ACTA and have paid all my fees. When will I be required to pay fees again? So your registration fee for ACTA's expedited route will be applied to your membership fees for your first year in the college. And it is expected that you will pay then your next registration fee just before the second year of the college. However, in the unlikely event that there is some protracted period of time, there's a possibility that ACTA could levy an additional fee, but we don't expect that to happen. We feel quite financially stable and viable, and as well, we've heard from the government that this is going to move forward. So the answer to that is before your second year of the college. Next slide, please. Why has proclamation taken so long? Okay, this is a common question that we get, and it's really because there's plenty to be done to open a regulatory college, as I've gone through. However, ACTA has completed most of the major components necessary to open the college doors. Proclamation of the regulation to establish the college relies upon the provincial government, and Alberta Health has a number of steps to take as well. Their next step is the public consultation, as Nicole had mentioned, and regulation and policy documents will then need some additional, after that, they will need some additional internal government circulation and then cabinet approval. So understandably, the government's focus in 2020 has been the COVID-19 pandemic, and many of their priorities were deferred until later. But however, as businesses starting to return to normal, and given the recent statement from the minister, we are expecting cabinet consideration of our regulation between fall of this year and early next year. And we're in close contact with the provincial government to continue to remind them that we are ready to become the college and to be helpful to them in the process of moving this forward. What are the ACTA fees being used for? So ACTA's fees are currently being used to set up the college. And this includes a small contingent of staff and consultants, development of technology, development of exams, and legal fees. Your fees that are paid now are applied to your first year of college membership. So a certain portion of the fees that we're receiving now are being held aside for first year operations. How will the college fees be determined? Well, the rate of future application and registration fees will be set at an amount the college needs to be a healthy and viable organization to carry out its mandate. So knowing that both ACTA and CCTA are not-for-profit organizations, our fees will be used for the operations of the CCTA. And a college the size of our college will need a staffing contingent of about 7 to 12 positions. And this is based on colleges of similar size in Alberta. Programs such as continuing competence, professional standards, and hearings tribunals will all need to be staffed and need to be operational. ACTA has been able to keep its expenses low by having a virtual office, by having only 2 staff who are willing and able to do a broad range of duties, and this keeps staffing and consulting expenses low, but also by the volunteer hours of the board and many others, which has kept our staffing and consulting expenses at a minimum. And ACTA will continue to be good stewards of our resources. The college will start with a skeleton staff and explore sharing resources with other colleges. We will add more expenses and staff later as needed. And as we get closer to opening the college, ACTA will be able to forecast a budget for the college, and fees will be set according to that budget. How will the average person in Alberta learn about this college and that there are now guidelines in place for those from the counseling professions? Well, as we get closer to opening the college, we'll work together with the Government of Alberta on communications. The Government of Alberta will take more of a lead on the public aspect, and we'll take more of a lead on the professional aspect. However, our joint and coordinated efforts will help each other out. The Government of Alberta will do media releases, hold press conferences, and there will be numerous social media posts from the government regarding the standing up of this college. And with the assistance of communications professionals, ACTA will be developing and implementing a robust communications plan regarding the transition of ACTA to CCTA. While this plan will target professionals and employers in the field, it will also go out to the public. And we'll also need the help of all of the professionals in the field to educate the public about this important change. So we will develop educational materials about the change that you can use to help spread the word. This will all take time, and it'll all take a joint effort between the college, the government, and all of the professionals in the field. And lastly, how will the college advocate for insurance coverage for counseling therapy, preferred rates for professional liability insurance, job creation, or standard fees for service? Well, the Healthcare Profession Act requires a clear separation of a regulatory college's responsibilities and functions that protect the public from the functions that are directed at the economic and social well-being of members of the professions. So advocating for increased employment opportunities, inclusion in insurance coverage, and setting fee schedules is really outside the scope and mandate of a college. ACTA's and CCTA's role is to build this college and to ensure the regulation. But once the professions are regulated, the professional associations will have additional leverage in their advocacy efforts for employment opportunities and insurance coverage. This is why association and college membership is so important. While there are clear delineations of functions and duties for each body, together they really complete the system. So. And if you have more questions, and I see we do have many in the Q&A, you can send your questions about the college to me. And if you have questions about your application, please send them to the fabulous Kelly, and her email is there as well.
So Linda, I've had a chance to read through the questions while you were talking. So why don't you, if it's hard to read and talk at the same time, why don't you look down the list and you start with question 12 and give me a few minutes here and I'll tackle the top questions above that.
Okay.
And I'll hand it over to you. So one was, will somatic psychology modalities be included in the scope of practice for counseling therapy? You could almost fill in the blank, any modality with that question. And I think it's important to understand that the competencies that the college is overseeing and regulating are the entry to practice competencies for the profession. So we spent a lot of time, I want to say years in the beginning, distilling the competencies that were represented across all of the associations and different kinds of counseling therapists in the province to those entry to practice competencies. There are many other competencies that you can develop as a therapist to broaden your scope of practice or strengthen your scope of practice. Some of those, for example, art therapy, scope of practice that just relate to art therapy. The Art Therapy Association will continue to set standards for, best standards in the profession for those practices. And that's true if you look at all of our professional associations. Many of them represent particular modalities and specialties. And specialty is a way of kind of thinking about it. This college oversees the entry to practice competencies. So I hope that that answered that question. Somebody asked about grandfathering. So just to underline again, there is what is commonly called a grandfathering or grandparenting process. We're using different language for a number of reasons. That process is represented in our expedited route, which has already started and which will end just prior to the college opening, probably about 2 months before the college opens, and our intermediate route. So there will still be, after the college opens, a way for professionals already in the field to apply and to demonstrate that they have the competencies. Related to that question was about exams and who has to write the exams. Those in the expedited route who've already applied or who apply while it's still open will not need to write an exam. They need to have one of the approved certifications as well as some of the other all of the other requirements we've laid out. Those who apply after the college opens may need to write the competency exam, but only in those circumstances that the registrar needs to apply the exam to help determine if they have the competencies. So not across the board, but in some cases. The jurisprudence exam that Linda mentioned, those who apply through the regular route will have to write it when they apply. All of us who apply through the expedited route, intermediate route, will all have to write it, but we'll write it as part of our continuing competence program in the first year of the college, not upon applying. Will the work of a counseling therapist be referred to as only counseling therapy or as counseling as well? Counseling is the practice, it's the thing that we do. Counseling therapy is the title. And actually, to be very specific, we have the ability under the Act to use counseling therapy or therapist or registered counseling therapist as the titles. And the board is going to decide which one it will apply. but those will be the titles you'll have to use to describe yourself first and foremost once the college opens, and then you might have other certifications and titles you might apply to as well. And the work of counseling is done by many people who have different professional designations. Social workers do counseling, psychologists do counseling. So it is shared, that scope of practice, across professions. The title is counseling therapist or registered counseling therapist. A related question was whether or not we can use the word psychotherapist. In the legislation that was passed and in the intent of it, it needs to be still developed out and refined, and that work is being done. The term psychotherapist is to be shared across multiple professions, and they're just determining all of which those will be. Certainly the College of Social Work, the College of Psychologists, and our college, and other colleges, I believe, as well, will be able to call themselves a psychotherapist. But still, again, your regulated title will be counseling therapist or addictions counselor or child youth care counselor. And then that might be an alternate way to describe yourself as well, that you will have access to. Will we be accepting student memberships? That's a great question, and that's come to our board, and we've wondered about it a number of times. I think it depends on how soon proclamation happens. As time goes by, there may be some capacity or interest in having student members, but at this time, really the ACTA mandate is very straightforward. It's just to develop the college, and so we've only had a membership category to accomplish that mandate, and to ensure that we have a group of people who will become the first registrants of the college. And so I would encourage students to become members of the member associations of FACT Alberta, and to stay connected in that way for now. Question about hiring practices, will they be changed with regulation? Linda did touch on that as well. I think it's fair to assume that regulation will impact insurance coverage, it will impact hiring practices, because the barrier for those things has up until now been the fact that counseling therapists, addictions counselors, child youth care counselors aren't regulated. However, it's a process we don't have control over, a process that all of the member associations and FACT Alberta will have to advocate for. And as education and time passes, I think that will develop, but it won't be immediately. Is there another route to obtain membership than the expedited route today? No, again, the only way to be a member of ACTA is to apply through the expedited route and be approved. And with that, I'm going to hand it over to you, Linda, if that's okay, to answer the question about how the exams are being developed and overseen.
Yeah, thank you. Well, I'll turn my video back on there. Well, I'm not sure, because I'm also going to be reading the questions. So, so I'm going to be focusing on reading it and then and I'll answer as well. Is the intent to maintain examinations all in-house, and will processes be in place to ensure reliability and validity of examination questions? So we are working with a reputable examination firm. They develop examinations based on our competencies. They have a robust, rigorous process for developing questions and testing questions, and that company is called Compass. They will be the administrator of our exams. They have developed many counseling therapy exams. They have developed the one in Ontario, so they're also well versed with working with the college like us. Is it resource intensive? Well, yes. However, if we're going to have an exam, if the college is going to have an exam, it should have the care and control of the exam, and so that it has a opportunity to establish accommodations policies and appeals policies for its exam. However, it will be administered by the third party Compass. Next question was, will my college membership be transferable provincially? Well, yes, under the Canada Free Trade Agreement, there should be reciprocity between the provinces. And those professionals whose credentials are recognized and accepted for licensing in one province should be recognized for licensing in another. So we are working very closely with the other provinces to ensure some alignment of our requirements and the like. As Alberta will be the first province to regulate addiction counseling and child and youth care counseling, though, the question of reciprocity between the provinces doesn't quite arise at this time. But when those other provinces begin to regulate these professions, there will be the same requirements for reciprocity as those that are placed on counseling therapy right now. Okay, so I'd like to clarify something. This individual says, we said that ACTA will be dissolved upon CCTA proclamation, but I was also talking about having a membership in both ACTA and CCTA. So let me be clear, when I was referring to the college and keeping a membership in your association, it wouldn't be membership in ACTA, it would be membership in your other associations, your home association that you're a member of right now. Is there an anticipated timeline for the creation of the educational requirements for regular route entry into the college? Well, yes and no. We have those requirements will be laid out in the regulation, and we're working together with the government to develop those requirements. But because the regulation is their document and isn't a public document, we can't say what's in it right now. As soon as it goes out for public consultation, though, we can talk about what's there. And so we're hoping that will be soon, and then we'll all know, we'll all have that information together. Sorry, just as you're answering the questions, the spots are changing. So I'm just going to, to another question here. How long will intermediate route remain open once initiated? So typically, intermediate routes, or what's commonly known as grandparenting routes, stay open for a couple of years after the college opens its doors. We haven't made the final decisions on the timing yet, but once we do, that will be communicated well to the membership and well in advance. Question about post-secondary training programs. Many colleges are well aligned with post-secondary training programs whereby completion of the program ensures entry into practice so long as other requirements are met. Is this the vision of our college? And I'd say yes, it is. So there is a body of work that needs to be completed around this, and where post-secondary institutions will work with a third party that we hire to map out their programs against our entry to practice competencies and requirements. And that work is going to take place, it's going to begin soon. We need our regulation to be up and running and passed, so before we can start that work. So we're hoping to get that done pretty quick in the new year. I have a social work diploma and other training, but I have never been registered. Do I have to be registered to be applicable for membership? And so you don't have to be registered in another college to enter our college. No, it's not a requirement. I have a question about child and youth care counseling. Pat, can I send that over to you? The question is, all child and youth care counseling members already approved by the expedited route, will they be a part of ACTA, or I assume the college automatically?
If you are already accepted into ACTA, then you are an ACTA member right now, if you've already gone through the expedited route. So yes, you are an ACTA member. And what was the second part of that question?
I think that was it. That was the question.
Yeah,
whether they're part of the college, if they've already been accepted.
Yes, and as described earlier, all those who are members of ACTA will automatically be transferred into the college once it's open.
Second question for you, Pat, while we've got you. What are the titles that can be used for child and youth care counseling?
So it'll be, my understanding, and you guys can correct me, but my understanding is it will be registered registered child and youth care counselor or child and youth care counselor registered.
Yeah, that's right. Another question that popped up around titles was, can I use the word therapy as well? Again, counseling, therapy, these are the things that we do. Maybe you do somatic experiencing therapy or art therapy. There's lots of ways we describe that what we do, lots of competencies and certifications we possess. The college has registered titles. Those titles, counseling therapist, regulated counseling therapist, that is the primary title that you will need to go by. And then you can describe the work that you do and use other certification titles and things as you would like, as long as you have, the college really only cares that you can demonstrate that you have achieved that competency in some way. So if you're using a title that's a certified title, did you actually do what you needed to do to get it? But the regulated titles are just the ones that we've mentioned. Someone's asking if the recording will be sent out, and yes, the recording will be sent out and posted also to our website.
I see a question about GST. Given that we will be included in the Health Professions Act, do we still need to charge the GST? And the short answer to that is yes for now, because the federal government requires 5 provincial regulators before in this field before you can stop. Now we will be 5 once we are proclaimed and we're up and running. However, the federal government is caught up a little bit on the titles of psychotherapy versus counseling therapy. So they haven't said to us that we can stop charging. So until we hear from them that we need to continue to charge that. However, just so you know, I'm forgetting the acronym now, but the National Body Association of Counseling Therapists is and Psychotherapy is advocating.
Yeah. So just to the question of titles, I understand how confusing it can be, and this is a learning curve for all of us. So connecting with Linda's answer about GST, just bear in mind that that was related to what's happening nationally, and that there isn't consistency across the country in terms of the titles that our new colleges are using. So you're a registered psychotherapist in Ontario, we will be a counseling therapist. So the federal government is trying to sort that out and understand that it is the same profession we're talking about, even though different titles. Within the province of Alberta, we do have clarity around our title of counseling therapist, and that psychotherapy is not a regulated title for any of the colleges, just a shared title, as I see that question popping up again here. Linda, do you want to tackle about mandatory registration? Someone's asking, will it be mandatory to register with the college? If you don't, can you practice anymore?
Once the college is proclaimed and open, if you wish to practice within the scope of practice, if you wish to do any of the restricted activities that will be laid out in the regulation, and if you wish to use any of the titles, then you must be registered with the college. So it is mandatory, yes.
I'll add to that as well that it's a process. So another question which connects to this is when will we have access to the intermediate and regular routes? How long will they be open? So the intermediate route will be open for 2 years after the college is open. So the day of proclamation, it won't become illegal for you to do the work that you do, but you will need to move towards being registered with the college. And my understanding is that mandatory registration is actually unique to Alberta as a province, which provides an extra layer of protection to the public, that not only can you just not call yourself a counseling therapist, addictions counselor, child youth care counselor without being part of the college, but you also can't continue to do that work and misrepresent yourself in that way. So it's a process that we'll be here to support everybody through, but you will need eventually to be registered through the college. And someone's asking when those routes open. Again, the day of proclamation, the intermediate and regular routes will be open. We are working hard towards that.
There's a question about using the title, right? What titles can be used right now? Can I use the title counseling therapists right now, or do I need to wait until the college has been proclaimed? And you can use that title right now. What you can't use is the title of registered. So, yes, you can use that right now. Do I have that correct, Nicole?
Yeah, you can use, and I think it's a good way to get used to using those titles. You're not mandated to use them yet, but it'll be good reason to do that. Someone is asking if Alberta Healthcare will cover the expenses of registered counseling therapist. I'm assuming what you mean is cover the cost of it to the consumer, the person getting the service. I don't anticipate well, certainly regulation would not be the thing that would cause a change to the current way that mental health services are paid for in our province under Alberta Health Services, and we have mental health, and some psychologists, social workers, psychiatric nurses, and in the future perhaps counseling therapists may work for Alberta Health Services and be paid by the government to provide those services, but there will continue to be a private sector for all of those professions in which those services are covered out of pocket by people or through the insurance that they have. A couple of people asked about the survey. The survey itself was meant for members of ACTA. And if you are a member, you should have, through our software program, received a message with a link to that. If you need to get it again, you can register or email our registrar. If you aren't a member of ACTA, you won't get the link for that particular survey, but we always welcome your feedback, and you can send us an email with your thoughts around anti-racism and the new college, or anything else that will help us to build the best college that we can. How many direct counseling hours are needed to register with the expedited route? 450, but a better answer is to look at the website where all of the requirements are listed out in a checklist for you, as well as a tool for you to track your direct client counseling hours, as well as your currency hours. More questions. I think we'll just refer to the website because it has the most accurate information around the requirements for applying. There's another question. I don't think you answered this, Linda. Again, I'm listening, reading, thinking at the same time. Second question about when you graduate from a post-secondary institution that is teaching from one of the three professions, will you immediately be able to apply for the regular route? So that's the goal, and the process would be, to the best of our abilities, to align the post-secondary training that's being offered with the college requirements, in the same way that over time has happened. And it's dynamic because the requirements for the college changes over time, and programs change in order to meet those, that. So that will happen through a process where the new college, and possibly ACTA sooner, once the requirements are approved and the regulations that we can start assessing the different programs to see how closely they teach to the entry to practice requirements, eventually have a process of approval, and do everything we can to make it as seamless as possible for new people in the field to move from their education and training to becoming a regulated professional. So we are at time. Some of our questions are quite specific to the situation of the person asking, or it would appear that we've answered them, but maybe we haven't quite in the way that you need. And so please email us if we did not answer your question or you have a follow-up question to our response. We're really happy to get your questions. They'll either be answered by Kelly or by Linda or myself or one of your members at large. Anything that we can do to support you in this process. So thank you again for joining us today, and look for further updates through our newsletter. If you aren't, you can go to the website if you haven't yet registered or signed up for it, and also future webinars and anything we can do to keep you updated on our progress. Thank you, Linda. Thank you, Pat and Russ and Sean, and I wish everybody a good day. Take care.
Bye, everyone.
Bye, everyone.
So long.